Hey, did you know that leprosy is the oldest disease known to mankind and it's often known as a social disease? It's a disease with high infectivity but low pathogenicity. In this video, we're going to learn about National Leprosy Eradication Program. National Leprosy Eradication Program NLEP. This is the logo of NLEP. Leprosy is also known as Hansen's disease. The World Leprosy Day is celebrated every year on the last Sunday of January. This year, it's on 30th Jan. The objectives of NLEP Strategy 2012-2017 is elimination of leprosy, the prevalence rate to less than 1 case per 10,000 population, to strengthen the disability prevention and medical rehabilitation of persons affected, and reduction of stigma associated. This is a very main factor in leprosy. The targets of leprosy is prevalence rate less than 1 per 10,000, that is to achieve 100% elimination by 2017, and annual case detection rate to less than 10 per 1 lakh population, cure rate for multibacillary more than 95% and paucibacillary for more than 97% cure rate, and to reduce the grade 2 disability to almost 35%. And the strategies of this program, as I mentioned earlier, for any health program, the first strategy is early diagnosis and prompt treatment. So, in diagnosis of leprosy in NLEP, we take the multibacillary and the paucibacillary cases. In paucibacillary, we have less than or equal to 5 lesions with 1 or no nerve involvement. Whereas in multibacillary, we have greater than 6 lesions with 2 or more nerve involvement. Lesions here indicate a hypopigmented or a hypoanesthetic patch, whereas nerve involvement means loss of nerve sensation and thickening of the nerve. In treatment, we have the RDC regimen, the rifampicin, dapsone and clofazimine. Rifampicin is given at the rate of 600 milligrams once a month. Dapsone is given at 100 milligrams daily dose. Clofazimine is given at 300 milligrams once a month. And for children, this is for adults. And for children, there are different doses. And also, for paucibacillary, the RDC regimen is for 6 months, whereas for multibacillary, it's doubled, that is for 12 months. In drug-resistant leprosy, firstly, rifampicin-resistant, we have the COM regimen, C for clofazimine, O for ofloxacin, M for minocycline. 6 months of starting phase and 18 months of continuation phase where we give COM. There's another regimen where there is COC, where minocycline is replaced by clarithromycin. And in both rifampicin and ofloxacin resistance, we give the CMC regimen, that is clofazimine, minocycline, and clarithromycin. Moving on to prophylaxis, the PEP prophylaxis, the post-exposure prophylaxis. Here we have a directly observed rifampicin supervised. For PrEP prophylaxis, we have an inclusion criteria and an exclusion criteria. In inclusion criteria, any person who has been living or working for more than 3 months or 2 hours a week with a newly detected leprosy case is included in this criteria. In exclusion criteria, we have pregnant women or any person who has been taking rifampicin for any other treatment like TB or earlier leprosy case, or if there's acute febrile illness. All this comes in exclusion criteria. They're not given the PEP prophylaxis. So for this, we give a single dose of rifampicin based on weight. If more than 35 kgs, we give 600 milligrams of rifampicin. 20 to 35, we give 450 milligrams. And less than 20 kgs, we give 10 to 15 milligrams per kg. Vaccine. So for leprosy, we have BCG and Lepravax. BCG is basically given for to prevent complicated forms of TB, but it is also used in leprosy. It provides immunity against leprosy. In Lepravax, it's an MIP vaccine, that is Mycobacterial Indicas vaccine. Earlier, it was known as MW vaccine. This gives a promising result in prevention of leprosy. What are the other strategies? One is integration of leprosy services through the general healthcare system. This is to provide a wider reach to the patients. And then household contact survey for early detection of cases. So we basically go door to door detecting leprosy based on symptoms or like lesions and any hypoanesthetic patches. Involvement of ASHA. ASHA plays a very important role in NLEP, where the person goes in search for the suspected case and detect leprosy early, and to follow up treatment cases completely, and to advise and motivate the self-care of patients, and to spread awareness are the functions of ASHA. They're also given incentives to bring out a suspected case of leprosy. Suppose, for example, for confirmed case, they're given rupees 250 and etc. And the next strategy is early diagnosis. In this, we have LCDC, the Leprosy Case Detection Campaign 2016-17, and Block Leprosy Awareness Campaign that is carried out along the week. So what happens when there's early diagnosis? That means case detection increases. That means the annual case detection rate increases. This leads to treatment and early eradication of leprosy. And then we have something called SAPL and LEC, which stands for Special Action Projects in Hard to Reach Areas and Leprosy Elimination Campaigns. So usually in hard to reach areas, in rural areas, the NLEP is not covered. So in these areas, we have special action projects to increase the awareness and for early detection of leprosy. Accompanied MDT. This is to prevent interruption in treatment. What happens in this is, if the leprosy patient is unable to come down to the health center and take their medication, any person related to the person can come and take the medication so that the treatment is complete. Next, we have DPMR, that is the Disease Prevention and Medical Rehabilitation. In this, the program is carried out in a 3-tier referral system where there's primary, secondary and tertiary levels. In primary, we have the subcenter and the PHCs. In secondary, we have district hospital and district nucleus. In tertiary, we have the reconstructive surgery center. In subcenter, some of the functions provided are self-care advice and advice to RCS cases. But if any patient presents with a leprosy reaction of a disability, they are referred to the next level. So in PHCs, we manage reactions of leprosy reaction and identify patients needing RCS footwear, and they're again referred to the tertiary center for reconstructive surgery. And similarly, in district hospital, we have management of complicated ulcer and leprosy reaction. If it's an unmanageable ulcer, then we refer the cases to RCS. So that's why it's a referral system where the actions are performed in the implementation centers, or if there are any advances, and then they're referred to the next higher level. Then moving on to Sparsh, it is an awareness campaign where we have an Indian mascot called Sapna. Sapna is a girl child symbol who represents the Indianized symbol of the UNICEF MENA. So for UNICEF, the MENA is the mascot. For India, it is Sapna for leprosy awareness, to remove stigma of leprosy from India. Next is the SET, the Survey, Education and the Treatment Scheme. This strategy is for every 20,000 and to 25,000 population. In this, there are different functions carried out where there is early detection of cases, door-to-door survey, health education, and free treatment of all cases. And here NGOs go for disability prevention and also care of the patients, and they're also referred to RCS, the reconstructive surgery centers. Then the most important concept of NLEP is IEC strategy, the information, education and communication strategy. In this, the focus is on communication for behavioral changes in the general public against the stigma and discrimination against the leprosy persons. It is expected that new cases keep coming regularly, but the people are still hesitant to come forward to get themselves diagnosed because of this stigma faced in the society. So here we have a poster of Sapna educating the public about the early diagnosis and treatment and why it's very important. So IEC plays a very important role in NLEP. So this is about NLEP. Hope you liked the video. See you in the next video, and please do like, share and subscribe.